So is fiber the new protein? Dr. Bob Ganz, let's talk about it. Just being a little bit tongue-in-cheek there about the importance of fiber. But I came across some interesting information, some new information about the GI tract and its immune function and how that can affect gut and systemic disease. I want to share it with you today. And fiber is an integral part of GI tract health. So let's talk about it. So you know that the GI tract assimilates your nutrients. Everybody knows that. You know that it's an endocrine organ, probably if you watch me on this channel. But today I want to talk about the immune function of the GI tract. And the GI tract is responsible for about 80%, 80% of the immune function in a human body. And it's obviously a very important immune function because you eat constantly, 3 meals a day plus snacks. Going out to eat, you're going to a grocery store, traveling out of the country maybe, you don't really know what you're putting in your system. There could be all kinds of pathogens. So you need a really robust immune system. It's kind of like the Great Wall of China. You've got this 30-foot long immune system, and it's got to be really, really robust to protect against pathogens. And if something happens to that immune system, if that immune system in your GI tract goes haywire, then you could have local inflammation if it overreacts, and that could spill over into the rest of your body. You can have all kinds of systemic inflammation. So all kinds of diseases have been associated with a malfunctioning microbiota, dysbiosis of the bacteria in your system, or a malfunctioning GI system. So let's look at some of these. So some of these systems we have neurological systems, psychiatric disorder, depression, anxiety, Parkinson's, Alzheimer's. We've talked about that before. You could have localized GI issues, irritable bowel syndrome, inflammatory bowel disease, metabolic liver disease. You could have systemic metabolic disease, things like obesity, type 2 diabetes. You could have increased atherosclerosis associated with malfunctioning microbiota. Certain cancers are associated with it, and certain immune-related disorders like asthma, eczema, etc., all associated with a malfunctioning GI immune system. So let's look at the GI immune system. So let's use the Great Wall of China analogy. So like any defensive system, a castle or a wall to keep out invaders, there's multiple layers of defense. Okay, so for a castle, you might have a moat, and then you've got stone walls, and then you have archers on those walls, and you could throw flaming oil over those walls. And the GI tract is no different. So the GI tract has all kinds of different layers of defense. So some of the layers of defense, the first layer of defense is the microbiota, a healthy microbiota that lives in your GI tract that can help fight off pathogens. Then you have a thick mucus layer that could trap pathogens. That mucus layer isn't as thick as it should be, pathogens could get through. Then the stone wall, you would have things like tight cell junctions. You don't want leaky cell junctions. And then you have all kinds of defensive factors. You've got white cells, macrophages, plasma cells, lymphocytes. All these things live deeper in the GI tract and help you fight off pathogens. So multiple layers: microbiota, the mucus system, tight cell junctions, defenses with your white cell system, and all the other antibodies that you elaborate. Now, if that system goes haywire, you could certainly see how there would be abnormal signaling. And remember that the GI tract is connected to the brain. There's a direct superhighway that goes between the GI tract and the brain called the vagus nerve. And all that signaling, healthy or abnormal signaling, goes directly to your brain, and the brain signals back to the GI tract. So you have this gut-brain axis that's very important to keep it well modulated, okay? Now, controlling the GI tract, this is the new stuff that I just found out. Controlling the GI tract immune system are things called inflammasomes. And inflammasomes are protein complexes that live within the white cells. They live within the castle wall, and they're like the alarm system. Think of an inflammasome as an alarm system. When a pathogen comes in, the inflammasome, this protein complex inside the white cells, gets triggered, and that is the master regulator of the entire GI defense immune system. So, like any alarm system, the inflammasome has to be tested every once in a while, right? You got to test your alarm system at home in your castle. You got to test it. So occasionally you get exposed to a pathogen, norovirus or rotavirus, or salmonella, shigella, pathologic E. coli, and the inflammasome system works. You fight off that pathogen. But here's the problem. If that inflammasome gets triggered all the time, if it's always being set off, if the alarm system's always being set off, then your immune system won't function well. Just like in your house, if your alarm system's going off every day, you're going to get anxious, there'll be issues. If your alarm system is always being tripped, if the inflammasomes are always being tripped in your GI tract, that's going to be a problem. That'll lead to local inflammation, then systemic inflammation, and all the diseases that I went over. So that's the key. That's why you have to have a healthy microbiome. Because if you have an inflammatory microbiome from either taking too many antibiotics or eating too many sugary foods or high fructose corn syrup, whatever, that inflammatory microbiome will constantly trip the inflammasomes, and that will set off localized inflammation, then systemic inflammation with leaky gut, etc. Or if you have low-grade pathogens always living in your system, like C. difficile or certain Firmicutes or Bacteroidetes species, then that will trip your inflammasome system. And those pathogens could actually lead to cancer in addition to the other things. So that's the new stuff that I'm talking about today, this inflammasome alarm system that we didn't really know about before. So bottom line is, you've got to have a healthy microbiota, and the way you have a healthy microbiota, we've talked about the multiple ways. Fiber, critically important to have a diverse, robust fiber intake, 25 to 35 grams a day. Almost nobody gets that in America, so you probably do need to supplement. If you're looking for a good supplement for fiber, and you've come this far in the video, I happen to like Relievance Fiber. That's the one I take every day. It's a good blend of soluble and insoluble fibers, but you can take whatever you want. And then all the other things we talked about, good skeletal muscle, because that'll help your microbiota develop properly, plenty of sleep, don't smoke, keep your alcohol intake to a minimum, deep breathing, stress reduction maneuvers, all those things lead to a healthy microbiome. But fiber is the key. A good, robust fiber intake is the key to a healthy microbiome, which will not trip your inflammasome alarm system, which will keep your gut immune system in check. Okay, that's a lot of info for you to digest, no pun intended, and we'll tackle some more interesting topics in a few days. Take care.